I think they remember the telenovela more. No? Anyway, I'll try to be as lively as possible. We're all tired, we might be sleepy, so let's just get this going. I just want to say I'm honored to be here on stage with so many illustrious people in the healthcare industry. Some of them are my teachers, and I'd like to say thank you. Dr. Ona, Dr. Camila Roa was my professor and my compadre, and then Dr. Cabral. They say we can see further to the horizon because of the shoulders of people we stand on, and they are shoulders that we can stand on. Thank you very much, my teachers. Now, some of you were my carpool mates in college, my Toledo. Some were friends, and I know so many of them. So let's get the ball rolling. I think one of the things that struck a chord was the term inequity, or the concept of inequity. It is both a symptom and a cause of many of the things that makes our healthcare still not good. So I'd like to start with that. And before anything else, I'd like to call on the Secretary of Health because she has a couple of clarifications and questions. Then we can start with that. And I have some questions for you on how we can solve this inequity. You want to say something, Sec Janet, or mamaya na? Oh, sige. So let's start the ball rolling. We have a lot of private sector representatives here. And one of the things they kept repeating was the government cannot do it alone. We need to work more closely with the private sector. But sometimes government does not trust the private sector. And sometimes the private sector doesn't trust government. We know that. I've come from the private sector. I mean, both private and government. So, but you have the MVP, Ayala, and what's the other one? The generics drug company. Sorry, you're right here. You are private companies venturing into healthcare. And I want to know now, how do you think you can contribute to solving the problems of inequity as private corporations, private companies? MVP, Ayala, you're known as profit organizations, but now Ayala is into primary healthcare. They put up a family law. MVP is putting up a lot of hospitals, and we have the generics, which I know has done a lot for helping bring down prices of medicines. So can we start? Who would like to? Maybe I'd like to start first with maybe Georgia Figueroa, okay, Ayala, because you're into primary healthcare, which is a gap that has to be filled.
Right. Thank you for the opportunity. Good afternoon, everybody. Okay, let's start off with this perceived notion that private doesn't trust government, and government maybe really doesn't trust private. No?
Worried, a little worried.
Yeah, but let's just say this. One of the main motivations, I think, for Ayala to get involved in primary healthcare is the awareness that a lot of problems can be solved by reinforcing primary healthcare to begin with. So if you have a good primary healthcare program and you build solidly on that foundation, a lot of good things can come out of it. For example, one of the notions mentioned by Dr. Melchon during your presentation is, let's talk about primary healthcare as a gatekeeper. That's a primary role. And then much was also mentioned about the fragmented landscape of healthcare. The fragmented landscape of healthcare poses a lot of questions, especially for your average one and one, the ones that we were talking about today. Where do they get started? How do they make sense of all these options that are presented in front of them? So I think that's where a good primary healthcare provider can start. And I think that's where, the notion of, let's say, among other things, as you may well know, Ayala was already involved. That started in the healthcare space by getting into generics through Generica. We also have, through partnerships with Ayala Land, QualiMed, which is a secondary and tertiary care outfit. And then they said, all right, how do we piece all of this together? So primary care came into the picture. And again, that's where this gateway, this gatekeeper role starts.
So you see yourselves as gatekeepers?
Well, that's the notion, that's the immediate vision for Family Law. Starting from there, And you apply many things, to strengthen this model. One of the key things that we believe in is this whole cluster of primary care, secondary and tertiary, drugstores. All of this has to be strengthened by the use of technology.
Okay. Yeah, because that's one of the things PhilHealth really has to look into is gatekeepers. I think you also mentioned it, Tony. As far as that's concerned, it's part of the primary care. We are actually, DOH and PhilHealth are really, that is the thrust now, is to have more primary and preventive care. Now, but what about MVP? It's a tertiary hospitals that you're building, correct?
Well, first of all, thank you very much for having us here. And Mingita is still as pretty as she was when we were in UP a couple of years ago. We were
That's 1980s.
Yeah,
He's still as bolero as he was.
But actually, I was listening intently first, if I may, to the presentations made by Dr. Lechon, and of course, my good friend, Secretary Cabral, as well as the presentation made by Secretary Garilao. And let me just say first that it is good that we have such a forum as what we're having today, because I had the privilege of hosting and facilitating as well as moderating a number of presidential debates or forums sponsored by PLDT as well as the group of Go Negosyo Joy Concepcion, as well as the Vice President presidential debate and the presidential debate in Cebu City, which was the responsibility of the NPP Media Group, TV5, Philippine Star, and Business World, and Interaction. And I would just like to share with you that I believe that there was not much emphasis given on health.
Nothing.
And that is the sad part, the sad reality. Knowing fully well that for a country to progress and grow, hopefully in double digits, you need to have a healthy workforce. If you have a sick people, or your people are sick, or your time is wasted taking care of your sick loved ones, how can a country grow? So it was a bit of a disappointment, if I may. I think I will not be risking getting some brickbats from the presidential candidates or the vice presidential candidates. Pero kulang po ng atensyon ang binigay doon sa mga debate na yun. Kaya ako po'y naniniwala na itong forum na ito ay malaking bagay because of the inputs of the distinguished people in this panel as well as those who spoke earlier. I think we should present whatever is taken up here to the next president, whoever he or she may be. It could be the leading contender, we don't know that. But clearly, it is something that we can present because I noticed during the debates, hindi po napag-usapan. Number two, yung sa syntax, I really have to admit and admire President Aquino and members of the Senate, led by Senator Drilon, and members of the House, led by Speaker Del Monte, as mentioned by Secretary Cabral. Because the syntax, this has been a pending bill for so long, but because of powerful forces, we knew it was not passed. But because of the political will of President Aquino, it was, and to a large measure, as you can see from the graphs presented, clearly it has helped a lot in terms of field health coverage, budget for the Department of Health, etc., etc. And let me just share with you that the reason why also this succeeded was it was the plan of the President as well as of Senator Drilon, the Senate President, not to push this as a revenue measure. Because if it was pushed as a revenue measure, then in all probability it would have failed. But it was pushed as a health measure, and that's why it has succeeded. And now with that, the MVP group, knowing fully well that government on its own cannot address the problems now facing the health industry, the MVP group decided to embark into the healthcare business. And as you know, we have about more than 10 to 11 hospitals at the moment. We have about 2,500 to 2,800 hospital beds. The target is eventually to go to 5,000 hospital beds and even up to 8,000 hospital beds. If I'm not mistaken, about 2 weeks ago, we just entered, I think, into agreement to also buy a hospital somewhere in Zamboanga. I don't know the exact details, but as far as the provinces are concerned, we have one in Davao, as you know, one, of course, in Negros, in Bacolod, and one in Central Luzon, and of course, majority.